How's everybody doing today? My name is Ed Crothers, and Good Horse Gone Bad pain demonstration here. We have a horse here right now that this mare has been in pleasure, been showed, doing really great, and we're going to use her of what a horse is supposed to do that's not in pain. So the first thing you kind of want to do is palpating the top line and just going down the back here. Going back here to the rump, push, but you can see that this mare is showing no sensitivity at all. Also on the other side of the back, and just pushing, just probing, taking your time, just push up and down, and if a horse is in any kind of pain, they're going to show resistance of getting away from the pressure. And actually today I'm just using my little pain finder here that I can probe and palpate different areas of the horse. Now going down here back of the rump, mare seems fine. And a lot of horses that are in pain, which people have said to me bunches of time, brushing these guys, they have real sensitivity to the brush. So, when horses are that sensitive, they are definitely in a lot of pain. Going down here. Up in the withers area, this mare is showing no sensitivity. And a lot of times checking for an ulcer, coming down this direction here, even going underneath, pushing up a little bit. Now this mare here probably 2 months ago had signs of an ulcer, and we put her on ulcer medicine for 2 months, and now she's doing great. Also going down the base of the neck here. Any vertebrae, any muscle, any sensitivity here, this mare would react. Also, checking up in the pole, pushing, just probing, no sensitivity up here. Move over to the other side. Over here, also, same. And you don't have to put a lot of pressure. Everything looks great over here. And just asking your horse to flex. But you see she has no problem. Picking her front leg up, putting a little pressure on the ankle. Not a lot, just a little bit. No problems there. And a lot of times these animals got problems, knees, ankles, front end. A lot of times you'll see the sensitivity up here on the top line, which she has none. And same thing in the back, just picking the leg up here, pulling up, not a lot of pressure. You can see here, she's fine, no sensitivity at all here, or no one put the leg back down, or trying to push me off by kicking. And a lot of times on checking a horse for any neurological problems or whatever, just, grabbing the horse's tail, and pulling, trying to pull the animal off balance, which you can see here, which you do not have to give this much pressure. I mean, I'm kind of going overboard here, but you can see. Anytime you're able to grab the tail, pull the animal's hips over, and the animal falls with you, you've got some kind of neurological problem. A lot of times it's EPM. A lot of times it could be a lot of other problems, possible injuries that they might have had down the road. But you can see this mare, like I said, you don't need this much strength. He's pulling, and of course she's fine. Also checking neurological problems, you can cross the front legs. A lot of times when you cross the front legs, one, they won't let you, or they'll immediately try to get away from you, like she just did. A lot of horses that have any neurological problems in the front end or the back end, you're able to cross that front leg and they keep that leg there. Chances are you've got some neurological problems, possible EPM, or a number of other things. So now checking this mare out, see no problems, which you can watch her, the activity, she don't care what we do with her. And this is what a horse is supposed to act like that has no pain issues. So what we're going to do here, we're going to change horses. We're going to bring a horse in here that actually was just brought to me 3 days ago. This is a horse that every time the owner turns it to the left, rears up. And now this is a horse that's broke, been trained, and been doing halfway decent into the last 3 months. So the horse is brought here to me to get the horse to turn better, get the horse to back up and do some of the pretty simple stuff. Also very spooky, this horse, she says. And this horse wasn't like this about 8 months ago. So this is a paint quarter horse. And a lot of these horses that are in pain, they can be a little concerned looking. This is a 9-year-old paint quarter horse that's had a lot of handling that shouldn't be acting this way. And just by his manner here, you can tell that he's just a little nervous, a little pushy, doesn't seem to be very happy to be here. So now what I'm going to do now is go over and check his top line here, and then we'll work our way from the back end to the front. A lot of times, these horses that are in a lot of pain, they do what he just did. He just stepped away. Now this is a horse that's been handled. He's stepping away because he didn't want me touching. Because any place I touch him here, it's going to hurt. And you can see him pushing there with Skylar. When Skylar puts a little down pressure, you can see that this animal doesn't like it. And you could take it as being disrespectful, but he actually is a horse that don't like his pole bent. There's a pain issue there. Now what I'm going to do today is I'm not going to fix the problem. I am just trying to show you how you can locate some problems that you're unable to see. A lot of times in my clinic, we move these animals around and I can pinpoint what leg he's getting off of, or what shoulder, what neck, whatever, and then I usually, of course, put the saddle on, try to ride them, and then go ahead and fix them, and then get back on the horses and ride them. So let's go ahead and see how many pain issues this guy's got. Easy. All right, you're all right. You can see right now how sensitivity is just me touching. So just going right down the spine here. Easy, you're all right. I'm just going right down his rump here. It's all right. Now the pressure I just put on, the pressure I just put on this horse is the same amount I put on the other horse. And sometimes it's kind of hard for people to understand, thinking, well, this horse is just a ticklish horse. No, this is pain. Okay, I'm going to go right down here from the withers here and see what we got going on. And he's not too bad. Now this right here, the way this could be a little ticklish here, okay? I'm going to check for an ulcer. Okay, so, and I'm probing up, and this guy seems to show no signs of an ulcer. Okay, we are definitely right in this area here. We got some problems. The other side, not as bad. Now we definitely got some pelvic problems going on here, right there, right there. And, you know, this is a horse that is turning him, he rears up, or if he sees something, he gets spooked and bolts and takes off. So as soon as this horse gets into any position of looking at something, and then as soon as his body drops down and these pain issues start, this horse runs away. I mean, he's going to get away from this. You know, we're definitely out in the pelvic. We got a little problem down here. Is probably definitely some soreness, muscle problems. And you see when I touch up here how he tightens up. Okay, well, he tightens up here. He tightens up here. So these muscles is overworking dramatically just for this animal to be able to move. So we're going to go to the other side here. Just turn it around, please, Skylar. Okay, so we on the left side, his neck. I'm sorry, we haven't got to the neck. From the withers back, we have three problems right there that has to be addressed. So we're going to come over here and see, and here we are. Actually, right through here, we're in pretty good shape. He's out over here, and he's definitely sore in this area here. And so right now we have a problem here, and we're pretty decent through here. I mean, most of the time when the horse is out really bad on this side over here, they're usually got show some pain here. So really, right now, from the withers back, our left side is showing us a whole lot more pain. And the biggest thing when you're looking for pain in your horse is you've got to figure out what problem caused all the other problems. And until you fix the main problem that caused this horse to get out in all these areas, you can get these all fixed. Once you start riding this horse, these same problems are going to come back after a couple months. And you can see this guy right here, he's just not real comfortable just standing here. You know, he's just worried about what I'm going to do next with my little pain finder here. And he's totally concerned. So we're going to move up to the front end. So we're going to go down his neck here, just down the base of his neck. We got a little sensitivity here in the shoulder a little bit. Usually when they show you a little sensitivity in here, it's usually the shoulder. Okay, we're going to go up here and probe up in this pole area. And we're pretty decent up here. I don't see any problems up here. Let's turn around and go back and check the other side of the neck. And you can see the way the animal just moves. He is watching every step he does. He's watching how he put in his body just to get himself as comfortable as he can. He's showing some sensitivity there. So this guy, he's got some sensitivity here on both sides of his neck, which is pretty common. This is up a little higher, and I can feel right here that I definitely got a little problem right here. And of course the back end is this horse has lots of problems here. And every time this lady turns him to the left, this horse just kind of rears up in the air and bolts to the right. And the biggest thing of it is, you know, most of his problem is on the right side. So, you know, most of the time when a horse has pain behind this line right here, the biggest thing they do is go forward. You know, these guys are trying to get away from the pain. Okay, when any of these animals got pain up in this area up, it hurts, so they either back up, rear up, or do anything they can to get away from the front end pain. They don't go through the pain, they try to get away from the pain. So a lot of times when they're hurting up in this area, they try to get away from the pain. The front end, they're backing up, rearing up, whatever they can do to get away from it. Back here, they're usually running forward. So this guy's got enough problems here in the front and the back to really cause discomfort and cause some of her problems. So this horse, if I put him in training and try to fix some of the problems that he's doing with her, rearing up, spooky, stopping, okay, I could probably get it done. Not very good. I mean, this lady, she's a pretty good rider, actually. She can do a lot of stuff herself, but she's been arguing with this horse and arguing with this horse. She's had enough, so she brought the horse to me. So, you know, fixing these pain issues, I'm going to knock down a whole bunch of training, a whole bunch of argument. I mean, like I said, this lady's a pretty good horse person, so when she said she argued and did all this stuff that she could think of to get this animal to go forward or do what she was asking. So let's go back to working on flexing on his neck. A lot of times a horse moving his neck and flexing and doing a one-range stop does not mean he doesn't have problems with his neck. It depends on how he is acting. He can move this part of his neck and make it around. He can move this part or even down this part, but he's got to move all these places. So I'm going to ask this horse to put his head around here and see how he does. Okay, when I get to this one spot, the horse spinning around, okay? And the thing of it is, he's spinning his head around because it hurts. Let me try on the other side here. Now this side over here, we're a whole lot better. Now he's rooting on me a little bit to get my arm off of the down pressure. Even if this horse didn't show me any sensitivity in the pole, you know, he's showing me now that he likes his neck out this way and come around on this side. Makes it more comfortable. Now when I ask this animal to push his head in here and pull it around, he gets really defensive. You know, he starts getting real defensive and pushing on me. And a lot of times these things can be actually look like he's just being disrespectful. You know, he needs to work a little more, he needs some manners. Well, if I can take a horse and get his neck to come around, knowing where his pain is, and getting his neck to come around, and he does it for me, and then I just take one little move by asking him to bend at the pole and put his neck around, and he can't do it. So that's pain, that's not disrespect. So, hey Rodney, give me a handful of hay. And sometimes when you're asked these horses to flex and you're trying to see if they got any pain problems, to see if it's pain or if it's just disrespect or they just need some more manners, a lot of times you can use treats, hay, anything that you can to ask this horse to move his head around, and he'll move it around for food versus you trying to force it around. So this guy is definitely showing some discomfort in the pole. Even when I push him down here, you know, he gets all upset. And this is a horse that's been trained. So, you know, the stuff we're doing with this horse is very simple exercises, and he knows how to do them. So we'll see what he does here when I ask him to come around this way for a little bit of hay. And you see how he's holding his neck. Now, if I sit up here and let him eat the hay, he'll eat it. Well, he should come around here and eat the hay too. So he's sitting there trying to keep his head straight because, like I said, a lot of places on his right side is out. And a lot of times when the horse is out over in this area, or left or right, to move his head to the left, it hurts over here. Now, if he moves his head this way, it takes pressure off of the muscles and off of the vertebrae, anything that's out, going towards the pain, it don't hurt as bad. But his neck to come around here, then all these places I had over there is going to make him hurt worse because they're pulling. On this side over here, he has the pain issues too. Now if I try to stretch his neck out a little bit, he comes around. But you see him kind of moving his head back and forth. It's because it's hurting. Now here, he'll eat the hay all day long. Now let's move to the other side and see how much I can get him to come around with the hay. Now you can see there, but if you've seen it, hopefully you did, he's holding his head out this way here. Now he comes and gets the hay and puts his head back straight. Now see how he's got his head kind of laying down and reaching? He's getting the hay and pulling it back so he can get his head straight and eat, where it's not as uncomfortable for him. See right there? I asked for too much. I asked for his head to come around and bend. He says he can't do it, so, you know, forget eating the hay. Now, you know, possible this horse could have some other problems, you know, checking the ankles and different other problems. I'm not going to check them today, just for the point that he's out off the top line, the neck, and definitely the pole. And I want to get those fixed before I check the other thing, just because it's making him uncomfortable and get a misreading when I ask him to flex at the ankle or even the stifle or the hock. And the biggest thing about this is when these guys are hurting and you break this down and just do some simple exercises and see what they can do and what they can't do, you start realizing that, you know, this horse turns to the right a whole lot better than he does to the left. His main problems are on the right. Now, to figure out what caused all of these problems, you know, I'm going to say that whatever has happened, and I'm guessing because I do not know, and him being out usually more on one side than the other, which is sometimes a little unusual. A lot of times we got a problem here when the horse gets out back here, or have problems here, then we got problems up here, then we go up here, over to this side, and over to this side. This horse has a little more problems on the right side. So there's a possibility he could have been run to the field, fell down, flipped over backwards. He's done something that got mainly his right side out of whack. And this lady's not been riding him a whole lot. So that's why we're not seeing as much on the left side, is because she hasn't rode him hard enough to get this animal to start compensating for the right side and having a whole lot more pain problems over there on the left. So this whole video was mainly just to show you on how to find some of the pain and let the horse tell you what he can do and what he can't do, and a lot of times it ain't disrespectful. We just use the hay here with him, and he's great over here on the right side. On the left side, he ain't going to eat. So I want to thank everybody today, and we'll check out and check you later.